something that's accessible for anyone to be able to get that right now. It would not even be possible. And I mean that with honestly, because I did have a difficult time even that day obtaining the medication because of an order that was put down in my state.
So your state was one of the states that said, nix the prescriptions of hydroxychloroquine. We saw that with a number of states, and your state was also one of them.
That day. Yes, and it was on that day. So you can imagine how terrified I was that, I had to really beg and plead and go through a whole lot to try to get the medication. And my husband was able to pick that prescription up that night, and I was better within a couple of hours.
I was better within a couple of hours after I picked up the prescription after begging and pleading for hydroxychloroquine because President Trump's direction and guidance has led hospitals and doctors to finally prescribe it. Are you? What are these people not listening? Are they not hearing these people? That's a Democrat representative from Michigan. And by the way, kudos to Karen Whitsitt. She went on Fox News. She didn't go on Rachel Maddow. She didn't go on Anderson Cooper. She went on Laura Ingraham's show to tell that story. That's a Democrat. Here was Governor Cuomo yesterday. I don't know how much more people need to hear. Here's the governor of New York, who's right in the middle of all this, holding daily briefings. They're giving him all the intelligence, all the information about what's happening in New York hospitals and treatment. Cut number 2 from Grabien.
There has been anecdotal evidence that it is promising. That's why we're going ahead. Doctors have to prescribe it. There are some people who have pre-existing conditions where it doesn't work, or they're taking medication that's not consistent with this treatment. But anecdotally, it's been positive.
Okay, and you want to push back? Let's figure out what the push. And here is the pushback, incidentally. Let's listen to a media montage, which suggests that this is all driven by Trump hatred. This is the proverbial Trump derangement syndrome. You hear all these cases of hydroxychloroquine working with many people and saving their lives, but since he was an early proponent of it possibly helping, they have to hate it. And I'm not kidding you. I'm not this naive. I don't want to believe this. I don't want to believe that the people I disagree with politically are so vile and hateful and frankly, practically evil, that they think that the trade-off is worth it. Let people get sick and die before you'll give Trump credit for anything? Are you that bad? Here's the montage, the media montage, cut 11, that Grabien put together, showing the jackals in the media tearing down hydroxychloroquine because Trump advocated for it.
Why is the president so convinced that this is the medication that needs to be stockpiled? What is in it for him?
This is a death of expertise.
Yeah.
This is when the idiots have been exposed.
This drug that the president keeps pushing, a lot of people would say, follow the money. There's got to be some sort of financial tie to someone somewhere that has the president pushing this repeatedly.
This was a 9/11 level failure of the federal government. It was. It needs to be talked about and covered and scrutinized that way.
That's some sick stuff right there. Honest to goodness, there's only one word to describe this: sick. I want every Democrat to heal from this. I want every liberal, I want every radical, crazy leftist to be well. I don't want anybody to be harmed by this virus or anything else. I don't care what your politics are. And if Hillary Clinton sat around and said, hey, I think hydroxychloroquine might work, and people started talking, believe me, you think I'd oppose a life-saving drug that's potentially a game changer because she advocated for it? You think I'm against it because now Cuomo is saying there's anecdotal evidence that it's working? And believe you me, they are prescribing it in New York a lot. A lot. I know that for a fact. My head's about to spin off. Let me get some callers in here. Please explain the pushback. Please tell me why you would push back. Help me understand this. We'll start with Joe here in the ReliefFactor.com studios, 21 before the hour. Hi, Joe. Thanks for hanging in there with us. How are you?
Good. Can you hear me?
Loud and clear.
Okay, perfect. So first off, I'm a Bernie bro,
Yes,
long-time Bernie supporter,
yes,
but I
sir.
do listen to conservative talk radio. But
Thank
the
you.
thing that I'm not pushing back. I think that, and by New York obviously prescribing it, I think that they know it's working. I think they just don't want medical malpractice happening. They don't want doctors beforehand just going and rushing and saying it. And you saw what happened when President Trump explained it the first time. People ran out, and unfortunately, accidents did happen. So I think it's more.
No, that's not. Wait a minute. Wait a minute, Joe. Be fair, Joe. What do you mean people ran out and accidents happened? What are you talking about? What do you mean by that?
So doctors were bombarded with people who, after President Trump said the drug, went to their doctor and called their doctor and said, "I want this." That put a strain. They were worried that it was going to put a strain on the system. So they said, "Okay, we're going to not just give it to everybody." So now we're going to, and obviously they're giving.
Now but wait a minute. But that's a far cry from what you just said. You said people ran out and accidents occurred. What accident?
Obviously, so you mean it's okay? Well, let's move on that because the fish tank thing did happen, and that was an accident, and we know the reason. But let's move on beyond that, though. Beyond that, what I'm trying to say is, the medical industry just does not want to go and tell the general public, "Yo, this thing works. Take," because one, they can be sued, and they don't want to lose their medical license.
They can't be sued. How can they be sued? Wait a minute. How can they be sued, Joe? What do you mean they can be sued? That's not malpractice. If a doctor can prescribe off-label all day long and they do it every day, you know that.
Yes.
You know that.
If something goes terribly wrong, and that drug is known to have problems,
hey, Joe, stuff is going terribly wrong. People are dying, Joe. Things are going terribly wrong. So let's go back to the other point you mixed in there for a minute ago about the stockpiling. See, that's now you're getting to the bottom line, because now we're getting to some truth here. In other words, it's a little bit like the masks. Remember they told us don't wear masks because they don't work? Now, we know the masks probably work, but they were probably trying to save the masks for healthcare workers. So essentially, they were lying to us. They told us not to wear masks or stockpile masks or buy masks because it could deplete them from the healthcare workers, which incidentally is a reasonable thing.
No one is saying that Chlorinique doesn't work. They're just saying it's irresponsible to just go tell everyone to go take this drug.
No one's telling you that it doesn't work. I just played a clip from the doctor who went on Fox News who said it's a quack drug and there's no data that it works. Plenty of people are saying it doesn't work. And yet, Joe, you're reasonable enough to realize tons of people are saying it's working.
Yes, there's difference of opinion, but if you play the full context of the clip, what they say is we need more research. Yes.
They need more research. Yeah, that's the other explanation. Guess what? It's off-label. We don't have time for more research. It has been used for decades, Joe. What do you think people with malaria, people with rheumatoid arthritis, people with lupus have been taking for years with minimal side effects? And incidentally, if the doctor thinks there could be a side effect, he doesn't prescribe it or she doesn't prescribe it. I appreciate your efforts there, my friend, but guess what? Everything except for the bit where you're talking about trying to have a supply and demand issue, that's the only thing that even comes close to making sense to me. Dr. Birx last night, Dr. Deborah Birx, highly respected. She's on with Fox News' Sean Hannity last night, cut number 12 rather, pointing out the doctor gets to make a decision, the patient should too. Cut 12, Fox News.
I think we do a lot of drug use off-label. Physicians do all the time, and I think that's why the president made it very clear that this is up to the physician and the patient, and what the president has worked really hard on is making sure that the medication is available in pharmacies and hospitals around the United States, so physicians have the ability to make that choice. At the same time, there are rigorous clinical trials going on, both by the WHO and NIH, to look at this drug and other drugs that are under development.
Seems like she's on board. And incidentally, back to the other caller's point here, the Bernie Bros point about being sued, wrong. The FDA has approved it for off-label use. There is no malpractice even on the table here. So that's another false assertion. Now, I don't know if this last caller had false assertions, if he's operating in good faith or bad faith. To the people who are in bad faith, if there are people who are literally opposing a potentially life-saving drug because you don't like Trump, You need to get help. You're sick. Your mind is so poisoned by your political hatred that you need help. Because people that I know, numerous people, at least 14 people that I can cite by name, say that their whole treatment hinged on, and the success came from hydroxychloroquine as prescribed by a doctor.